However, dude, we have a bunch of friends who are like the world champion adventure racers, and they've done Raid Gawa and Eco Challenge. And one of our friends came back and pooped a big worm after being in Borneo. So the worm thing is real. And we have another friend who was Meryl Street's stunt double in a river wild, and she ran this section of the White Nile, and got neuroschistosomiasis. She got schistosomiasis, laid eggs in her spine. Now she's paralyzed. So parasites are real, and
are no joke. Yeah.
So, for example, Juliet, my wife, is a 3-time world champion, and she was attacked by a hippo on a canoe safari on the Zambezi River in Africa. So they've just won the world championships. They're downstream. They're paddling around, and a hippo attacks her canoe. Teeth goes through the boat. She gets cut. She's in the water. The crocs. The hippo's chomping the boat. She swims to shore. 3 more days in the canoe. 4 more days in the canoe. They just duct tape a lid. By way of saying that now we really respect animals. People are like, you're not going to get attacked by a bear. Well, you could get attacked by a bear. You're not going to get attacked by a shark. We're like, these things do happen. They've happened to us. So, you snort one worm out of like a mezcal bottle in college. I mean, you've cracked that Pandora's box. Like you can't go back. So I think it was really reasonable to freak out.
I watched a kid at my 501 party when Rush ends. When I first joined my fraternity, he chugs the worm, pukes it up, and I hear a bunch of fraternity brothers yell, "Eat it!" And he grabs it out of his puke and he eats it again. And I was like, "That's going to be my friend right there. That's my new best friend.
That's brother. That's brothers. That's amazing.
That's fraternity." Yeah, I don't joke around, and that's a question I have for you. Knowing all the medical knowledge you have and all the being a physical therapist for so many years, I know such a small amount, and I don't know if it's dangerous because I know it or it's a good thing, but I am such a hypochondriac. And then every time, like you said, you thought you had a brain tumor, I can find, like, I've called you 1,000 times where I'm like, Kelly, my nerves are shot. I think I have ALS. I automatically go to the most devastating one. I start preparing for my funeral. It's always, do I have a brain tumor? Am I starting to get paralyzed? Am I going blind? And I don't know. I mean, I've read about pre-meds disease, but part of me is like, how do I get rid of this? It's such a bad, I think it's part of my interest in health is that I'm like, okay, I want to be on top of everything to make sure I can take care of myself.
Yeah, that's a really part of the problem is people want a name for something. They want to diagnose something, around, like, just so we're clear, my default self-diagnosis is I have meningitis all the time. I'm like, oh, it's meningitis. Like Juliet's like, no, you just haven't had any water today. I'm like, I'm sure it's meningitis. I'm sure it's meningitis. And I think one of the issues actually currently today is especially musculoskeletal healthcare, is that we lost the narrative on pain massively. We lost our relationship to pain. We lost our relationship. Then the Sacklers came in and ruined that. And then we used pain as a vital sign for a while in medicine, where like that was, instead of really understanding the nature of pain. And that meant that it was easy for us to catastrophize right away when we had pain. Pain is a medical problem. We have to manage this pain. And, it's an easy lens to start to sell stuff to people. And like, you have to do these things. Your body is fragile. If you round your back, your spine will explode. And what we are working towards shifting this narrative around is saying that, hey, do you have some basic training of when you should go get help? Like you're getting crazy visions and a worm comes out of your nose. It's reasonable to go to the doctor. That's actually super reasonable. We want everyone to understand red flags. Do you have night sweats, dizziness, fever, vomiting, nausea, unaccounted for weight loss, weight gain, changes in bladder bowel function? Are you pooping yourself when you sneeze? Like there's some things that are coming up that if you have a fever and it smells like you're sick, you should go to the emergency room. That's that. And we want everyone on the planet to have that so that everyone is triaging each other. Hey, bro, like you have a crushing headache and you're losing your vision. This is a stroke. These are the symptoms of a heart attack. Let's get you out of here. We've had a couple people at our gym show up and they're like, hey, I don't know if I should warm up today. And we start to talk to them and we're like, well, we call 911 and they have strokes. they're having a stroke. Wow. We catch it and send them to the ER, and the docs call us and we're like, thanks very much for saving this person's life. All we did was like saying, hey, I don't think you're appropriate to train today. Like, you know, we're not going to do it. Do you want to do a handstand push-up? No. All right, let's leave. So, but simultaneously, we want everyone else to understand, and this clear line of saying that, hey, can you do your job? Can you do your role in the family? Can you occupy a role in society? Is there a bone sticking out of your leg? No. Do you have a red flag, like a fever going on? No. Well, if you can answer like, hey, I don't have a trauma, like where I heard something snap, or I know I have a clear mechanism of injury, I didn't get hit by a car, but I can still do my job. You're not injured. You have pain, and there may be something going on, and your brain may be working hard to tell you, I need you to change something. And that change could be many, many, many things. That could be you're stressed. That makes you more likely to experience pain. You can be highly congested and inflamed. One of my coach friends, Yami Tikkanen, you know, super coach, Annie Torrey's daughter's coach. He and I were doing a little tour through Europe 10 years ago, training, coaching, teaching. We were doing this mad dash, like 5 countries, 7 courses, and we were eating all the waffles. We were on a pastry pro fun tour. We may had not like drinking all the alcohol, and he had injured his finger on the national judo team back when he was a much younger kid. And all of a sudden, that old judo injury, literally, he's like, I can't flex my finger. I'm so inflamed. My finger is stuck. This is where I dislocated it. So our not sleeping, our drinking, our pastry shenanigans led his body to revolt, where suddenly he became sensitized. So there can be some lifestyle stuff we have to talk about. So when I'm trying to work through pain or problems with my athletes, I talk to them. Tell me about your sleep. How do you track it? How do I know? Like, we have to make sure we're not making a basic error in that thing. Are you getting sunlight? Do you feel loved? Do you feel safe at home? I mean, those things are true. Are you under stress at work? Then we can start saying, well, are you moving like a jackass? And I don't mean that you have to move perfectly, but there are ways of moving that are more effective and less effective. Like heel striking, you can heel strike for a long time, but that's not a very effective way to run. It's a less effective way to run. And it may be that your body suddenly became sensitized to that. So we can change your mechanics or improve. Hey, I see that every time you bend over and you round your back, and that's just less effective. So let's see if we can get you more of a mid-range position, a little bit more organized, where you can take a breath, et cetera, et cetera. Hey, you're sitting 12 hours a day. Let's just sit less than 12 hours a day and see if that doesn't change. But then we can also ask, like, do you have normal range of motion in your joints and tissues? Can you put your arms over your head, yes or no? So when suddenly we start to ask those questions, right, is there something you can do to improve the health or the robustness of the system? Turns out any one of those things could be enough to change your pain or turn off the pain. Because remember, your brain is basically interpreting signals from your body as threat or non-threat. That's really the truth. And I've seen people with broken bones that we manage the congestion of, like we decongest the tissues, we pump it out, they have no swelling, they go into the ER, and the doctor's like, you don't have a broken collarbone because you're not in pain. And because they don't have any swelling, he's like, put your hand here, and the bones are grinding together, and they're like, they're obviously it's a complete fracture. And the guy's like, wow, I can't believe this, you don't have any pain. So we want you to understand pain is a liar. Pain is a request for change. But as long as we have come out of this tradition of the 80s and 90s where we were given opiates and we're managing pain and thinking that you're fragile, and then we have a group of people who just aren't loading their bodies, aren't getting in sun, don't eat meat and fruits and vegetables, who are like arguing about this on the internet while they're in their lazy boys. What we're seeing is this sort of amalgam where it is easy to start to become fearful of your body, instead of realizing that your body really and truly is extraordinary and will put up with your crap for a long time.